Hi, today I'm going to talk about spondylosis and spondylolisthesis. A lot of patients that have come to see me have had an X-ray organised by either their general practitioner, physiotherapist, osteopath, and they've read the report and they've come to me for a second opinion. The word spondylosis often comes up, and very rarely the word spondylolisthesis comes up, and these are two completely different things, and that's what we're going to focus on today. Well, the term spondylosis is a generic term that covers all areas of wear and tear on the spine, but it generally means evidence on an X-ray or an MRI or CT of wear and tear in the bones and little knuckles forming, whereas spondylolisthesis is a condition where one bone slips forward over the other. So if we look at the spine, here's a picture of the spine. These are the vertebral bodies, a stack of bones that are cushioned by these tissues here that we call discs. And then at the back, this is the back, this is the front. At the back, the bones are also held together or joined together by these joints called facet joints, which help prevent them slipping forwards and backwards and allow a couple of degrees of angulations. What happens with bad posture, weight gain, wear and tear, and a normal disc here starts to degenerate, starts to dehydrate and tear a bit. And then in the context of spondylosis or degenerative change, the disc thins out, flattens, and then if we come down here, you notice that you start to form these bony knuckles. So if we look at a typical X-ray of someone with spondylosis, this is what we see. This is a front view, and you start to notice these little sort of knuckles of bone, these spurs of bone sticking out either side of the disc space. This is the front view of someone's spine. Up here, this is a fairly normal bone here, it's well circumscribed. You don't really have much of a great big knuckle of bone forming. These things can also be seen in the neck, in the cervical spine, as well as the lumbar spine, and they're signs of wear and tear as mentioned. So if you see these things, they're not necessarily bad in themselves, and it's a fairly common finding in people who have no back pain or no symptoms, but it is a sign that there is wearing and tearing of your spine, and there are measures you can take to help prevent that. So maintaining a strong core, your posture at work, keeping your back straight, regular exercise, weight loss, and all these things are really important. If you have back pain or neck pain, work with a physiotherapist or one of our osteopaths. That can be helpful in the long term. When it starts to become a concern is if you start having symptoms of pain shooting down one of your legs, or if you have neck pain and symptoms going in the arms, and you see spondylosis on an X-ray, it could be a sign that one of these knuckles of bone also contains some disc material in it that's pinching the nerve, and that's where an MRI scan is more useful. But spondylosis alone in the context of neck pain and back pain is not necessarily a bad thing, and it's something that can be managed conservatively without anything invasive. So provided the pain is just in your neck or in the back without any arm pain or any leg pain, and you've had a plain X-ray showing the spondylosis, the measures you can take are core strengthening exercises for the lumbar spine. I've written a blog here on common causes of back pain and methods you can find relief. There's a link below on manual therapy, physiotherapy exercises you can do to treat that. If the pain is mostly in the neck, and provided you don't have any symptoms in the arms and legs, please have a read of my blog on understanding neck pain. Again, the link is below. I've also recently done a YouTube video on cervical radiculopathy, but that's specifically if you have arm pain. But obviously your workstation, looking at mobile phones and all of these things can accelerate the pain and the symptoms. So improving your posture and your workstation, things like that, are important measures you can take. And again, these are things that the osteopaths we work with and physiotherapists and chiropractors can help you with. Spondylolisthesis is another condition, but does start off with wear and tear of the spine. So again, if we go back to this picture of the spine, this is the front, this is the back. Earlier we talked about the facet joints, this joint here, which is the bony attachment at the back that stops this bone, for example, moving forwards relative to that bone. And the spondylolisthesis is where one bone abnormally starts to slowly slip forwards relative to the bone below. There are two main causes of this that we broadly talk about. One is called an isthmic spondylolisthesis, where you have a defect in this bone here, the pars bone. It's quite literally a crack, which is a kind of stress fracture through the bone, not necessarily from trauma or any specific incident, but we often see it in slightly younger patients, cricketers, fast bowlers, horse riders sometimes, where you've got repetitive stress on the joint of the spine with certain motions that can cause it, and then later in life it can cause problems with the bone slipping forward and pain in the spine. The other form is a simple degenerative spondylolisthesis, where the joint capsule itself just wears down, the straps that hold it together, the ligaments weaken, and over time the bone starts to slip forward. Here is an example of someone I recently treated with a spondylolisthesis, an isthmic spondylolisthesis. So you can see here on her x-ray, this is the front, this is the back this time round. This bone has slipped forwards relative to the bone underneath it. And you can see here a defect across this bone here called the pars, which has allowed that over time to slip forwards. At the Spine MDT, we still try and manage spondylolisthesis non-operatively when we can, with the help of our physiotherapists and osteopaths under the guidance of a surgeon and the findings of the scan. Usually building the muscles that support and surround the spine can stop the slip getting worse, but if it fails, then we can manage this with fairly minimally invasive surgical techniques. Going back to this patient we discussed earlier with a spondylolisthesis, the conservative measures had failed, so she underwent a lumbar interbody fusion, shown on this x-ray here, and you can see the alignment is now restored with this bone back to where it was, and that was achieved with screws in each bone and rods connecting those screws through two very small incisions in the lower back. The disc is removed, and in its place is this titanium cage which allows this bone here and this bone here to grow through and fuse up and join together, and this patient did really well, symptoms completely pain-free thereafter. I hope you found this video useful. Please subscribe to our channel for more videos about spine care, or visit us at spinemdt.com to find out more about our one-stop spine clinic. We're a unique clinic of all disciplines of spine care, physiotherapists, osteopaths, chiropractors and spine surgeons under one organisation, together looking for the least invasive solution that gives you the longest lasting result. Thank you.